Hello, leaders of the world. Welcome to Spread Love and Organizations, a podcast for purpose-driven healthcare leaders striving to make life better around the world by leading their teams with genuine care, servant leadership, and love. I'm Naji, your host for this podcast, having the pleasure to be joined today by Stephanie Chen, ChenMed's Chief Legal Officer and Culture Officer. Stephanie has been with ChenMed since 2006 and served as General Counsel prior to being named Chief Legal Officer in 2016. A graduate from New York Law School, which she attended on a Harlan Scholarship, Stephanie was admitted to the Florida Bar in 2008. She graduated cum laude from Boston College with a degree in economics. Stephanie and her husband, Dr. Chris Chen, the CEO of ChenMed, have 4 children together and live in Florida. It is such a pleasure to have you with me, Stephanie, today.
It's a pleasure to be here, Naji. Thank you so very much for the warm welcome.
Can you first please share with us a little bit more about your personal story from law to now being in healthcare as Chief Legal Officer and Culture Officer in this industry?
Definitely. You said with love. So I'll start with, I married my high school sweetheart, Chris, and I've been together since I was 15 years old. We went to my prom together, and he came to my high school graduation. So we kind of have a funny story in that way. I was married as a college sophomore. And so that's kind of, if anyone's been to Boston College in your audience, that's not normal at Boston College. And so most students live on campus there. And so I was off campus, married to a Beth Israel Deaconess resident. But we grew up together, and I wouldn't change any of it. He's a great guy. So that's my love story. And then growing up in healthcare, to be honest, if you had asked me when I was maybe 12 or 13, I don't know if I would have said I'm going to end up in healthcare. I loved caring for people, but I've never loved science. So what's really wonderful about the healthcare industry is that I get to care for patients and people and not be a physician or a nurse nurse practitioner or even a medical assistant. None of those things appeal to me. But changing the world appeals to me, and caring for people has always appealed to me. So healthcare, I think, has both of those things: an impact on the world and an impact and a chance to love on people in an individual way.
Oh, for sure. This is our why. This is why we wake up every morning trying to bring an impact and help patients live better. I'm really intrigued by ChenMed, and specifically after I received from a friend who sent me an article about how you are transforming love into profits in healthcare. So I was very intrigued because my podcast talked about spreading love in organizations. So I'd love to hear a little bit more about what you do and really the values that you bring in your I shouldn't say company, it's more in your organization, I should say.
Yeah, well, thank you for asking, Naji. So maybe like 8 years ago, I remember being in a room where Chris was presenting to the family. We're a family-run company, right? Family-owned and operated. But we have an executive team, and we've got like 6,000 employees. So we're not a mom and pop anymore, but it still very much feels like a mom and pop. He presented to the family the values that he wanted our company to have. And there were 3. And I remember being so critical in my mind because the 3 were love, accountability, and passion. And I just spoke up and said, love and passion in a workplace environment sounds so weird. It sounds like a litigation waiting to happen, right? Like we're going to get sexual harassment claims, like love and passion, sounds like something that should be on an true Hollywood story. But he was really convicted and really passionate about making those 3 our company values. And we have them as defined terms. We have like love is defined in 4 ways, accountability is defined in 5 ways, and then passion is defined in 4 ways. And we really are those 3 things at ChenMed. And we live out love for each other. That's one of the things we value every human being as an incredible creation of God who brings value. And so that's one of them. We also love people enough to tell them the truth. That's one of our values of love, and give them open and honest feedback. And we invest in others as part of our love at ChenMed and help develop everyone to be the best they can be. And then accountability, obviously in healthcare, there's so much data, right? And there's just so much around results. And obviously the results are bigger than profits. The results are changing people's lives and keeping people healthier longer, and changing the healthcare statistics in the country, right? Around cancer survival rates. ChenMed has done that. Around life expectancy in the zip codes we serve. There's a 20-year age gap in the zip codes we serve versus in a zip code maybe that you or I would live in, Najee. And so like just really working at that life expectancy discrepancy and chipping away at that. And so that accountability is huge. And then passion is just like our zest for what we do. And at ChenMed, we really love what we do. We wake up in the morning with inspiring energy, and that's how passion's defined. And we bring new energy to each day. And so when Chris said those three, I was like, this sounds like a nightmare, but I was really wrong, because they really are the best values to define what it's like to live and work at ChenMed. And I think because of those, people are just confident in how they bring their passions and their zaniness and their love to work, and even their accountability too.
I love it. And I when I came, for the little story, when I came from France to the US, so I've been spreading love in the organization where I work for some years now. And when I moved here, the first thing they told me, don't talk about love in the workplace. You're going to end up in a very bad situation as a French Lebanese guy, talking about these things. So when you said like love and passion and, legally what you thought about, it was the same for me. But at the end, as you said, like this is actually what can bring impact, caring for one another, for us to at the end care for the customers and ultimately help patients live better. So I love how you define it. How do you build this culture daily, in ChenMed? Because there's so much you're doing. So how daily do you build this within the team for them to be focused really on love for people, for one another, and love for the patients?
It's one-on-one, which does not sound scalable, but it really is. We have to hire for people who really want this in their own life as well. And then they have to want to push it out, because I can't be in Detroit or Louisville or Atlanta or New Orleans or, Memphis, right? And none of us can. And so we have to hire beautiful, loving people in Memphis and in Detroit and Atlanta who want this in their lives as well. And then that's the first thing. So it's people. You got to get the right people. And then the second thing is it's cultivated. So in our town halls, in our emails, in our meetings, we really do try to remind everyone of the beautiful purpose of why we're here. One of my favorite books is Simon Sinek's Start With Why. And he just hits the nail on the head with we have to constantly be reminded of why we're doing things. And why we're here. And so I think just starting with why. And so our town halls are literally like a 1-hour love meeting, like a love fest, to make that, sound funny and inappropriate. But it really is celebrating our team members who've gone above and beyond, celebrating our patient victories and the data, celebrating. We had an 87-year-old patient get engaged because she wasn't healthy enough to even like leave her home. And then she became healthy enough to be social. And then she became healthy enough to like find a fiance. And she was just so happy. And so that's like a story we told on our town hall of loneliness to love, and just celebrating those, because we impact so many patients, and we have to know and be reminded, because our job is very hard in healthcare everywhere. It's a very hard job. So we have to constantly remember why we're doing it.
So talking about this, that was actually my second question, right? If you work in a highly stressful environment these days with low staffing, we read all over overworked healthcare professionals.
Yeah.
How do you do to keep really love at the heart of what you do and actually support this mission?
I wish I could say we did it perfectly. I'm constantly striving to figure out how to do it better. That's like my full-time job, because it's understaffing, triple masking, changing protocols, right? The stress is just so very high, and it's always like do more and do better and do faster and do better quality in healthcare, right? And so I would say that we work on care teams. We say that we are all here to serve our physicians and our nurse practitioners, and so it's a team that really does help encapsulate with returning messages, looking at emails, like getting scripts organized, calling the day before and asking our patients, our senior patients, can you bring all the medications you're on so we can see what you're taking, what you're out of. We really do try to have a one-stop shop at ChenMed. I don't know if you're familiar with our model, but it's all encompassing care. And we look at all the social determinants of health. We look at if they don't have the money for their copay and they're not taking their blood thinner. Well, what does that look like for a hospitalization, right? And so, hey, how can we get that copay in a payment plan for you? Even if it's only $5 or $10, how can we help you pay just 50 cents or $1 today so that you don't stop taking an important medication? We make sure they have Uber Health and rides to their specialists. And if their daughter or son or brother or sister can't take them to a specialist, we make sure they get there no matter what. And so we really do try to have this care team that comes around the physicians and the nurses and the staff to make sure that that load is co-labored and that the burden is carried together with others. We really do believe that it's got to be a team. It's got to be kind of like, I don't know, I have a strong Christian faith. And so a lot of my analogies are from the Bible, but there's this cord of three strands cannot easily be broken. And so it's like, I think burnout comes when a physician feels alone. I think burnout comes when a nurse feels alone and that they have to carry the heavy weight of their panel by themselves. And at ChenMed, that's not the case. They should be fully supported by our home office staff and by their care team.
I'm intrigued since you're talking about teams. Do you, for example, train your people? Do you have like leadership, efficiency, work together? And what are the ones you're focused on, since like one of your values is love and passion?
So much training, so much training, Najee. We believe in lifelong learning at ChenMed. So even our physicians, basically, we realized that in medical school, you're not really totally trained on kind of like the positive no, or even degrees of influence. Now, I didn't go to medical school, and I don't mean any slight, but I know in 4 years, you're learning a lot of other things more than kind of like family influence or things like that. And so at ChenMed, we have so much physician training around how to influence, how to provide for full care, how to ask different questions to get to the right answer, and things like that. So they can go through training here at ChenMed that we've specifically designed for our physicians and PCP leaders. Our PCP leadership train is amazing. I was just at a partners weekend in Orlando, and it's just awesome to see people who've been employed here 20 years, 15 years, 18 years, and just keep getting promoted. And now are leading teams and markets and national groups.
I would love now to go to the part where I will give you a word, and I'd love your reaction to it.
I'm the most excited and nervous about this, Najee. I knew you were going to do this, and I kept thinking, what is he going to say?
So the first one is leadership.
Okay. I think by example. I think to be a good leader, you have to walk what you talk, and you got to be consistent. And yeah.
What about health equity?
That breaks my heart is the first thing I think about it, because it feels like a fundamental right that we should all be, the day we're born, we should have the same chance as everyone else. And the fact that that's not the case here in the United States as a developed nation really should break everyone's heart. That wakes me up in the morning and keeps me doing my job every day.
So I want to double click on this, because this is one of the focus areas that you work on in ChenMed. Can you tell us a little bit more what you've done and also the data that you've been able to deliver?
Sure. So we started in Miami Gardens, and if you don't know Miami well, that's a poorer neighborhood in Miami, a beautiful neighborhood in Miami, but lower income and medically underserved, which means the doctors to people who need doctors ratio is low. There's not enough doctors in that community. And we just happened to start there. My father and mother-in-law had one office. Their story is incredible. They're two immigrants from China who came here, went bankrupt in a restaurant business. And then they're very brilliant. My father-in-law, a PhD already in Wisconsin, moved to Miami homeless with 2 children and went to medical school in 2 years, because as a PhD, they had that program, and then became a physician in Miami Gardens with these 2 sons, basically without a home. But in Miami Gardens, what he found was that so much of healthcare actually was just care and not even anything to do with medicine. And so he found that, you know, what I said about missing a copay or missing a specialist appointment or just using the emergency room as their only form of healthcare instead of true prevention, right? With colonoscopies and mammograms and everything else and blood work and staying healthy and diet and loneliness and community. So they started this one center in Miami Gardens in a medically underserved neighborhood and realized the great need. And so that became the model. Is where else can we scale and go where there's a need for doctors? And let's not move into like the county hospital where there's already, 700 doctors on the elevator list. Let's go into medically underserved neighborhoods and help the communities that need us most. And so we've done that, and we've grown exponentially, mainly word of mouth. I mean, until very recently, we didn't have a marketing team. We don't pay for Super Bowl commercials or anything like that. And so it's very grassroots, word of mouth. Once one person in a church finds out about us, we end up having like 300 patients from that church and things like that. And so, but really a heart to change the outcomes. And so if you check out our impact report, the data is all there, but we have doubled cancer survivor rates in 6 months, which is just insane. If a drug could do that, I think it would be like multi-billion, Najee, and ChenMed has done that through our care model. We see our patients frequently and often, and we have smaller physician panel sizes so that we can know our patients intimately well. And I think that is kind of back to almost the olden days in our minds in the movies where a physician would come to your home with like the leather bag. I don't know if you're getting that visual, but and they would know the brother and the son and the horse's name. And so we don't have horses, but the thing is, like, if you know someone really, really well, you know what's off for them or what's low for them or what's high for them. And so then you can cater your medicine to them. So that's our model in a nutshell. There's more data on the impact report. I didn't give you that much, but I wanted you to check it out at chenmed.com.
I will. And so one that might be related, modern healthcare.
I think it's disjointed and fractured. I think you can get a lot of tests done. And because of just, I don't know if it's various electronic medical record systems or HIPAA, or lack of communication, but there's like a lot of tea leaves, but no one reading all of them, if that makes sense. Like, especially if you have something you're really trying to get to the bottom of, it can take a long time because of the disjointed and fractured system we have, and physicians not speaking to physicians, kind of all on a unified team, if that makes sense.
What about SpreadLove?
I don't mean that to sound overly critical.
No. It's your view on the challenges we're facing, which is definitely data is definitely one of the biggest challenges, and how they are interconnected and who owns them, and are we really looking into them for us to make intentional decisions about our health?
Right.
The last one is spread love in organizations.
With how you show up, like one human at a time. I think there's something wonderful about being at scale. We've certainly grown exponentially at ChenMed, but the only thing I would say is you've got to have like a playbook and a strategy around love. You can't forget about it. I think people are so quick to make sure the model is scalable, and even us sometimes at ChenMed, and how do we figure out how to hire at scale and grow at scale? But you have to figure out how to love at scale, and you have to figure out how to always look for a situation where everyone can win, like a win-win situation. That's part of our mission statement at ChenMed, and I think that's loving others. If I'm looking for how you can benefit, Najee, and then you're looking for how I can benefit, and then we're both looking together at how our patients can benefit, that's how we really spread love. So, yeah.
Thank you for that. I love it. Love at scale. I love this. Any final word of wisdom, Stephanie, for healthcare leaders specifically around the world?
Do what you love. Don't defer your life. Don't have a deferred life plan. There's kind of like we grow up, at least in America, I don't know about in France or in Lebanon, but if you eat your peas, you get the pie. right? Like if you do the hard thing, you get to do the good thing. And I think a lot of people live like, if I work hard now, I can do what I love when I retire. And I think that is a lie. So don't buy into that lie. I read that when I was like 18 years old in a book, The Monk and the Riddle. And I try to live every day, waking up, doing what I love. And there's so much room in healthcare to do what you love. You don't have to switch jobs. You don't have to retire. You don't have to become an author. Stay a physician, but do what you love in a place that believes in you and is for you, and where you can do what you love in healthcare. Don't leave healthcare to do what you love. You can do it in healthcare at the right spot.
That's such a great advice and word of wisdom, for sure. Life is too short to do things we don't like.
Too short. And what if you never get to retire, right? Like what if we could either of us have something horrible that happens tomorrow. So we got to do what we love today.
So true. Thank you so much again, Stephanie, for being with me today. It was such an incredible chat.
What an honor, and thank you, and a privilege. Have a great day.
Thank you all for listening to Spread Love in Organizations podcast. Subscribe and connect with us on SpreadLoveIO.com or wherever you listen to your podcasts. Most importantly, spread love in your organizations and spread the word around you to inspire others and amplify this movement our world so desperately needs.